Hi guys, this is Dr. Nida with Keys of Health. So COVID-19 has reached almost every part of the world. Half the world is under a lockdown right now, just to flatten the curve so people and medical facilities have a chance to fight this virus. At this point, it is extremely important that we play our part. There are two things we can do. Be responsible and remain at home, maintain social distance. And the second thing we need to know is know the symptoms of this virus so we can act accordingly and appropriately. There are mixed reports of the symptoms of COVID-19. Some recently recovered individuals have reported symptoms like fever, chills and shivers, tingling feeling in hands or feet, sore throat. These are all symptoms of a typical flu. However, what is not so common, but these symptoms are experienced by some COVID patients, are symptoms like body aches, headaches, fatigue, congestion, and runny nose. It is understandable that many people wouldn't even consider that they would have coronavirus, especially if they have not come in contact with someone who is sick or has been tested positive. You cannot guess based on the symptoms whether you have influenza, COVID-19, or something else. Testing is crucial, but this is where it gets complicated. Testing is not easily available. In fact, in some places like the United States of America, it is not available at all in some places and not to vast majority of the people. This is why it is important to pay attention to the symptoms and be pragmatic about them. First major sign of coronavirus, first major symptom is high temperature. Fever is most common on an average 5 days after the exposure. Temperatures above 101 degrees Fahrenheit or 38 degrees Celsius is high enough. Close to 90% of the COVID patients have had fevers. There is a reason for that. It is your body's attempt to kill off pathogens which are sensitive to temperature change. Next symptom is coughing. Because it is a respiratory virus which is attacking your lungs, your body's natural response is to cough out and get rid of this obstruction in the airways. Now, it is not a wet cough, it is a dry cough. So you have fever, you have dry cough. Then comes intense fatigue. Your body wants to rest in order to recuperate and fight off whatever is hurting it. The problem is that these are all consistent with symptoms of a common flu. You may have seen comparison sheets being published by various sources comparing COVID-19 to common cold and flu and allergies. Pay attention to those. I would recommend you save those sheets. I will share them with you in the About section of this video, and I also post it on Facebook and Instagram. But remember, these are indicators, not a proof. You need to get tested to be sure that you have COVID-19. Then what about people who cannot get tested? This is where isolation comes in. We have to be realistic and pragmatic, and we have to be responsible. If you have checked off, let's say about 90% of the symptoms on these lists that I have shared with you, you need to go in self-isolation. That means a room with no one else in there with you. When you use the bathroom, disinfect it after yourself. No one shares your towel, your utensils are separated, and I suggest you don't come out into the living room and sit on the couch. Stay in one place which has proper lighting and ventilation. If you can get sunlight in the room, it is a luxury, it's a plus. Make sure you open the windows and let in fresh air, even if you are cold. Bundle up for those few minutes and let the air circulate. You don't want your room to become an incubator of germs. Take regular showers. That will not only keep you clean, it will also make you feel better and normal. Change a set of clothes daily or every time you sweat from the fever. Make sure your clothes are washed separately from other people in the house and on maximum high temperature. You are not in prison. You're not being punished. You don't want to go into a mental crisis. You just want to be responsible to make sure no one else is infected until you receive medical help. If you can get an air purifier, it's a plus. It will relieve stress from your lungs and help them heal properly. Remember, all we are doing is creating an environment to help your body fight the virus and heal itself. We're not treating it per se. We are enabling it to heal itself. There are hotlines in some places, virtual clinics in others. There are field hospitals dedicated to COVID cases in some areas. I don't know where you are and what is in place where you are. But now would be a good time to find out what you should do if, God forbid, you do catch this virus and become positive. If during this time you develop breathing problems, please don't wait any longer. Put on protective gear like a mask, change into a fresh set of clothing, and go to the hospital. Remember, a vast majority of the people who recover from COVID-19 without needing any medical intervention. During this time, drink plenty of fluids, especially warm drinks and water, and some fresh juices. But drink those juices at room temperature. Don't take any dairy products during this time. Dairy can cause inflammation, and it is best to avoid it in case of any possible infection in the body. Take light food like bone broth, chicken soup, or other light soups. Don't force yourself to eat, but make sure whatever you eat, it is nutritious and energizing for the body. Include honey, black seeds, ginger, garlic, onions in your diet. All of these have antimicrobial and immune boosting properties, which is what you need. Meditate, pray, listen to audiobooks, podcasts, whatever helps relax your mind and soul. Rest is half the medication. Please don't administer any drugs on your own. If you can't write out the fever, you can take fever-reducing meds to help bring down your fever if you can't tolerate it. Doctors are recommending taking paracetamol instead of ibuprofen. Panadol and Tylenol contain paracetamol, whereas Aleve, aspirin, and Advil belong to the ibuprofen family, so they should be avoided. This is not concrete knowledge, but at this time, it is better to be safe than sorry. Please be kind to your family and control your impulse to mingle with them if you suspect yourself to be COVID positive. If you develop breathing problems, don't remain in self-isolation anymore. Go to the hospital. If you have a COVID patient at home, please don't go outside for at least 14 days after a recovery to avoid spreading the infection in case you are a carrier. Remember, these advices are for a healthy individual. If you are immunocompromised, have underlying health conditions like diabetes or heart problems, you need to have those discussions with your doctors now so you know what is the right course of action for you. I am positive that if we all play our role, maintain social distancing, go into self-isolation if we have come in contact with people who were tested positive, or when we ourselves display symptoms, and follow proper guidelines, we will be able to fight it off and come out stronger. Please stay safe out there, take care of yourself, and take care of each other. Please subscribe to my channel and please help spread the word by sharing this video with your friends and family. I'll see you next time. Take care. Bye-bye.